in my life. Hi, everyone. Good evening, and welcome to Back to Basics. I'm Dr. Vivian Asamoah, and you are on the Natural Gut Relief private Facebook group. It is wonderful to see everyone here this evening. We just finished and we were wrapping up, and so I think this is going to be sort of like a regular Thursday vibe. And it's actually perfect because on Thursday evenings, myself and Bianca De La Rosa, our dietitian, have several functional medicine consultations. So tonight is like a perfect, Thursday evenings is a perfect time to really talk about everything functional medicine. And I wanted to take a minute to talk about our functional medicine gastro program and how my journey began and which has now become the team's journey. So I welcome any questions you may have. This is a live Q&A. I have a couple questions that patients have already sent and shared with me that I will go over. But I thought I'd just start by talking about the practice of gastroenterology and how I decided to bring functional medicine into this. And I may be looking at Michelle now and then because she's my cue if something's going off. So bear with me. So I'm Vivian Asamoah. You guys know me. I'm a gastroenterologist. I went to medical school in Switzerland and in Geneva, and there is a lot of homeopathy and natural medicine in Europe. So it was really part of the way we practiced. And then I trained at Johns Hopkins for fellowship under the tutelage of Dr. Jerry Mullen and also Dr. Lee, who was trained in Eastern medicine, so did a lot of acupuncture. So there was a lot of influence from integrative gastroenterologists. So that was already a big part of our training. And I was very interested in nutrition and how it impacted our patients with GI issues, and did a lot of rotations with our nutrition teams and our bariatric teams, and giving parenteral nutrition, sort of TPN and enteral nutrition, and placing peg tubes. So that was a particular interest of mine. But I think the passion and the understanding of bringing nutrition into my practice as a gastroenterologist and as a way to treat our patients with gastroenterology disorders only became evident when I really started practicing about 10 years ago on my own. And I realized how much food impacted our patients in so many ways, either developing, leading to conditions, or making underlying conditions worse. And how important it was for us as gastroenterologists, not just to, but to prevent. And as a practitioner, as a physician, as a medical doctor who actually went into this profession to heal and prevent disease, I didn't want to be the type of practitioner who was just prescribing medication and prescribing and prescribing and prescribing. I really wanted to empower patients with knowledge, with education about what they could do to improve their own gut health. So that led to that first journey about how do I educate myself a little bit better, because I'll tell you that medical school didn't do it. Even the training at Johns Hopkins didn't do it. I just didn't get enough information about nutrition and wellness and how to bring that into my patients' lives. And so one of the first things I did when I set up my own practice 6 years ago is I partnered with a dietitian. And throughout the 6 years in practice, I've always had a fantastic dietitian at our practice. And we started off with just one-on-one consultations, just educating patients and guiding patients. But then I also realized that even in the field of, the practice and the training for registered dietitians and nutritionists, they kind of had an old school approach about nutrition, right? Where they were talking mostly about, don't eat high fat foods because you're going to gain weight and it's going to increase your cholesterol. But now the science has shown us the reverse, right? It's really high carb and high sugar that does a lot of the damage. And there's good fats and bad fats. So even working with these different dietitians, I realized that, you know what, there's more to learn. There's still more to learn. And I grew with a dietitian by the name of Chanel. Chanel, if you're watching this, hi. And Chanel was conventional. But as I grew in my functional medicine practice and I started learning more, she also turned to doing more training in terms of functional nutrition and started coaching patients synergistically the way we thought it would really help a lot of their gut issues. So, one big thing about functional medicine or bringing that into the practice is it requires collaboration, not just collaboration with the patient, but also a team collaboration with specialists who can help you in whatever discipline the patient needs. And when you really break down functional medicine, it is trying to dig into root cause medicine. And we learned that root cause medicine is very, very cellular. It really is very cellular because we actually know now through research in wellness that stress affects the cells on a cellular level, causing inflammation, which then drives disease processes. And we never learned medicine that way. You guys, we all learned medicine like cardiology, gastro, this is the GI tract, this is dermatology, this is the hepatology side, this is skin. But in learning functional medicine and really going to that cellular level, which is really very scientific, we learn that all of these paths connect. All of these dots in the human body connect as one. And to me, that made a lot of sense. Now, I will tell you guys, I'm nerdy. I'm very nerdy. I am extremely nerdy. I'm very academic. And so a lot of people who understand that I'm learning functional medicine or practicing functional medicine, you know, when you hear the word functional medicine or sometimes even integrative medicine out there, I remember one of my patients saying, "Oh, Dr. V, so you're now doing holistic medicine." So that's become a joke in our office, like, what is holistic medicine? It almost sounds like some kind of voodoo medicine, but it's not. If you're working with a true functional medicine provider, these are some of the most intelligent providers, I believe, right? At least the people that I'm learning from, because they dig all the way down to root cause. It is not some of the functional medicine that we hear today or we see out there on social media or, you know, being advertised that is very superficial. There's superficial functional medicine, just people who gotta touch and, oh, take these probiotics, oh, careful with mold toxicity. But then there are people who really have studied it, who understand it, who can explain the pathophysiological pathways of what happens, and who can stand their ground in an arena of academic scientists to explain the rationale of how heavy mold toxicity or heavy metal toxicity leads to liver toxicity, right? And that it's not always just fatty liver or it's not just always this. But then you have a lot of people who are functional medicine providers out there who may not know true medicine, right? And I'm not alluding to any groups in particular, but you only know what you know. You only know what you know. So if you're a dietitian practicing functional medicine, you'll be very strong in whatever is functional nutrition, right, aspect. But when it comes to the in-depth medicine, you don't know it because you haven't studied it, right? I think chiropractors are doing a lot of wellness, and that really helps in terms of things that are nutrition and, you know, just general body energy levels, metabolism, manipulation. And then you have chiropractor and chiropractor, right? I see a chiropractor who's fantastic, wonderful, but also the depth of knowledge depends on every individual, right? And then you have acupuncturists who are also practicing functional medicine. But when you use the term functional medicine provider, it's a very generalized term. I don't know what it means quite yet, but I can define what I'm aspiring to do. I am a functional gastroenterologist, and I want to be an excellent functional gastroenterologist. What I want to do is bring conventional gastroenterology, what I've learned in my trainings from Johns Hopkins over too many years, I'll tell you that, in Baltimore, and that what I've learned from my medical training at the University of Geneva in Switzerland in terms of homeopathic training, what I have gathered over the years learning with the registered dietitians that I have worked with, and finally, where I invested a lot of my time and my effort is my training with the Institute of Functional Medicine, learning from the best of the best, and also from the School of Applied Functional Medicine. I'm going to whatever school I can learn from, where I know that the lecturers and the mentors giving us the training are highly trained, well educated, well versed in what they're doing. So I want to make sure that I'm a gastroenterologist who bridges conventional gastroenterology with functional medicine to make sure that I can lead to sustainable change, optimal gut health for my patients. So, as a gastroenterologist, I want to make sure I'm doing my screening colonoscopies on point. But if a patient comes to me with abdominal pain, I still have to do the workup. I cannot assume it's all diet related. I have to order a CT scan, get an ultrasound. Is it the gallbladder? What else is going on? I got to dig deeper, just as a gastroenterologist would. And when I've done all those things and I realize that this appears to be more of a functional gastroenterology chronic issue, and we'll talk about that in a little bit more detail, then I want to bring in that additional knowledge that I have learned over the years about how to manage stress, the impact of nutrition, different types of therapeutic food plans, different types of botanicals, different types of nutraceuticals, supplements, evidence-based supplements that over the years have been shown through multiple studies to work in different kind of disease entities that will ultimately do less harm and provide more benefit, because sometimes the prescription medications we give, guys, the acid blocker medications, I'm guilty, right? PPI. I've done I think I got to go to jail for PPI, giving too many PPI. But I'm learning now. I've learned over the years that there are certain patients who need it, and there are many patients who don't need it. And the goal is to wean patients off instead of just kind of, feeding and boosting the PPI pharmaceutical industry. But because I now know the damage that PPIs can cause, right? And I've also seen, I'm very passionate about this, guys, so I know I'm talking a lot, but there's so much to share. I've also seen that in my training in functional medicine, and as I collaborate with other functional medicine providers in whatever specialties, gastroenterology, gynecology, neurology, I've also seen what is happening in our true American Gastroenterology Association in terms of our research. It almost seems like we are 5 years behind what functional medicine is doing and how functional medicine is evolving. And the scariest thing about that is that if you are being, cared for or followed by a physician or a practitioner that is not even keeping abreast and keeping up to date with that 5-year-old research, they really don't know what's going on today. And I feel that the people who have taught me the most about what is up and coming in the literature, what is the next practice of medicine, how to really transform the kind of care we're providing right now, are my patients. My patients are actually the ones who continue to read. They're searching for information to heal themselves naturally. And they are the ones out there saying, well, Dr. V, did you see this study on this? And I'm like, no, I haven't. Let me go look it up. And I learn because it's a real study. It was really there. Or it's a study that is questionable and we have to discuss it. But patients, I feel right now in today's medicine, and I think because of the way today's medicine has evolved, are doing a lot more independent research, trying to get their own answers from reliable sources, right? And sometimes there's too much information out there, and it's hard for people to really know what's valuable information, what's not valuable information. And I think if you can get this information from a trusted practitioner that knows that specialty and can say, well, this is what we know from conventional, this is what we know from functional, this makes sense, yes, let's apply it to you, it's reassuring. The patient doesn't have to be the doctor. They have to be educated to know about it, but you don't need that extra burden on top of a chronic illness that you're dealing with to now have to do all the work yourself. And I'm thinking about a patient in particular who one time said to me, like, well, I felt like I was doing all the research and just telling the doctor what to do, and I didn't get any support, and they didn't even go and do the research about what I was trying to explain. And this was a patient who was very educated, very intelligent, really was doing a lot of research about her own issues, and needed a partner to collaborate in her health, in her progress, needed someone who was going to validate what she was looking at or help her understand the reasoning behind it. And I hope that that is what I achieve in this functional gastro program. So this is really about the program. Hello, Miss Lee. And I have some questions from people that I want to answer because I won't ramble as much and I'll be a lot more specific about it. So I want to just go over some of the questions that I've had. And anyone who has questions, please feel free. This is a live Q&A, so please feel free to ask. But I'm going to go to some questions that actually came up from my own team. So some people say, some people ask, what makes this program different than seeing a conventional GI doctor? The program is different, but I think the doctor you see is what is really important, right? It's you're, I aspire to be a provider who's kind of blending the two, right? Bringing sort of cutting edge medicine and where we're going in medicine in terms of making sure that nutrition is a big part of how we practice and what we share with our patients, right? But I will say the biggest difference here is that I don't just stop at EGD colonoscopy. I hope that I don't just stop at a lab work or EGD colonoscopy and biopsy and say, well, we didn't find anything, so I'm not really sure why you've been bloated for the last 15 years. I hope I'm the kind of provider who wants to dig a little bit deeper. And with some of the testing that functional medicine offers, we are able to do a lot more testing and also offer a lot more counseling in terms of nutrition and understanding the patient's journey, understanding your journey and how you've come to this place. So that I think is one of the biggest differences for me. Functional medicine is going to the root cause, but it is also dealing with chronic illness, right? And how do we prevent? How do we halt the progression of? And how do we reverse? That's a huge part of functional medicine that I think conventional medicine doesn't have. Right now, we wait for you to get diabetic, so we give you, oral anti-diabetics or give you insulin, or we wait for you to get severe joint destruction before we actually give you biologics or immunomodulators to halt the progression of rheumatoid arthritis. But with functional medicine, what we're trying to do is when we start seeing signs of autoimmunogenicity, when we start seeing that blood work that shows a positive ANA, we stop and say, well, what can we do to actually prevent this titer or this inflammation that's about to be, drive other systemic issues or other disease processes like skin and gut and joint issues? How do we prevent it from getting worse? And what is going on in this person's body right now that is driving this inflammation? A simple example would be even fatty liver disease, right? And so I see a lot of patients with fatty liver disease. How do I prevent them from reaching the stage of cirrhosis, right? We know that fatty liver disease is probably going to become one of the leading causes of liver transplants. It used to be alcohol, used to be viral hepatitis, but very soon it's going to be fatty liver disease. And we know that really is affected by insulin resistance. And so as a gastroenterologist, and a hepatologist, it is not enough for me to say, yeah, just go lose weight. Just go lose weight and, we'll see you in 3 months and we'll do blood work. I think that's what a conventional gastroenterologist would do, right? Let's just see if you have cirrhosis. Let's do some blood work. Let's go lose weight. I'll see you in 3 months. And the patient comes back in 3 months and it's status quo. Nothing has changed. I hope that through this functional gastro program, I can provide our patients with tools and tips. So first they can understand, what is fatty liver disease? What am I doing that is probably precipitating or making this worse? What are my outcomes? Why do I have to wait for cirrhosis? How do I reverse any kind of scarring that I may have in the liver? And patients always say, what can I do naturally? Like, what can I do to stop this process? And so when we talk about weight loss, we have a dietitian who really helps you with the weight loss program. And at our functional gastro program, and I think me and the dietitian say this all the time, Bianca, we don't do diets. We do therapeutic food plans. We don't do weight loss. We don't do weight loss here. There's no weight loss program. There's no weight loss private Facebook group. We do lifestyle change. So this change can impact not just you, but maybe your spouse, your brother, your mother, your sister, your child, who carries the same genetics as you. And if they don't start from a young age and trying to transform, reverse whatever kind of, impact or lifestyle that they may have had, they will also get liver disease and they will also get cirrhosis. So we try and do that. So we have a dietitian who helps, and we have an infrared sauna, and we tell patients, you don't like to exercise, come in the sauna. Sauna has shown to reduce weight loss by 20% more doing being on the right food plan, and then doing the sauna, you lose 20% more weight. So you don't want to exercise, fine, at least let's go ahead and do the sauna. But then she helps you with and coaches you in terms of intermittent fasting. Is it the right way for you to go? Should you be doing something different? And then of course I come in and I've done all this research on nutraceuticals and natural supplements for liver disease. I wrote a book chapter on it. I'm now writing, actually trying to collaborate with another hepatologist to write like a Q&A from one of our traditional, conventional GI journals, because I want other gastroenterologists to be able to use not just prescription medication, but things like alpha lipoic acid, which works great, things like berberine, which controls insulin resistance, omega fish oil, my favorite, all the way, which we know helps reverse a fatty liver disease, right? And in some patients, we've actually seen reversal of scarring and reversal of fibrosis. So trying to do all of those things instead of waiting for cirrhosis to happen and then dealing with all the complications. I think that's how this practice is different. And in doing that, we decided to create a signature functional gastro program for patients really who have chronic GI issues, chronic GI and liver issues, who've tried the conventional route and want to dig deeper, right? Who want to dig a little bit deeper and see if they can get to root cause and find nutraceuticals, find supplements, find the right therapeutic food plans to help slow things down, reverse things, and transform things. And so it's a 12-week program that we created, and we work with our dietitian, and we do some specialty testing if need be. We use conventional testing as much as we can because we want to make sure that if it's covered through insurance, we use it. And these are 1-hour conversations about your journey. We go all the way from birth, whether you got breast milk versus bottled milk, and life traumas that may have impacted and caused stress in your life, which causes chronic inflammation. We talk about environmental factors. I mean, we've discovered people who lived near, high, who were exposed to heavy metals because of where they lived, and then saw that it impacted their liver in different ways. We talk about medications you may have been prescribed that are interacting. So we do a lot of revision in terms of interactions of your medications and even supplements. And then we make recommendations from, nutrition, stress, sleep, nutraceuticals, doing additional testing to get to root cause, collaborating with other functional MDs, naturopaths, or, chiropractors that we work with. Because as functional gastroenterologists, I don't tackle everything. I think it's really hard to be, I don't want to be jack of all trades and master of none. And I will say that as a gastroenterologist, that is what I love and enjoy doing. And so what I want to do is be able to provide that functional medicine expertise in my specialty. There's so much to learn. And most functional providers will tell you that the gut is where everything starts. So I really want to be very, very good at that. And so I don't do hormones like female hormones. I'll refer you to functional gynecologists. We have an excellent functional neurologist that we work with when our patients have neurological issues like multiple sclerosis. We see a lot of patients with leaky gut and leaky brain, so we refer out. I have an anesthesiologist who does wonderful work with pain, but from a functional perspective. So using a lot of natural remedies, doing a lot of visual imagery, meditation, just counseling patients on how to tolerate and support pain instead of using medication. So I'm trying to develop like a little tribe of functional specialists that can collaborate with me to help my patients that I love. And that's ultimately my goal. Let me see if there are any other questions. How do I know if I'm a good fit? I was just talking to Michelle about that, and we said, you're a good fit if you are ready to transform your life because some of these therapeutic food plans are not easy to do. I can attest to that. I've done an elimination diet for 4 weeks. I almost killed my husband. I was so hungry all the time. Hangry. I was hangry all the time. And right now, I'm on day 4 of my sugar free. We're doing our 7-day sugar free challenge on day 4, and someone had to snatch a dry cranberry out of my head. I saw that cranberry and I was like, "Is that sugar? Is that sugar?" And they said 22 grams, Dr. V. So I know it's hard. And so you have to be committed and you have to be ready. And I'm not going to lie, there's some patients who we propose the plan and they come for another visit and they haven't started. And I usually say, let's stop here. I'm not going to charge you for doing a program that you're not doing. And I don't want to, I'm not that kind of provider. So let's stop here. We will do no more visits until you are ready again. And very often, when that is said, I don't know, it's like a magic pill. 2 weeks later, they're like, I'm ready, Dr. V. I'm ready. I'm going to do the anti candida diet. I feel great already. So sometimes you have to kind of like do that tough love thing where you're like, I can't work with you because you're not ready. So you have to also be ready to, you have to realize that we're in this for the long haul. And this is actually a 12-week, so 3-month reset your gut type program. So don't expect changes overnight. But I will say, guys, I have been so surprised by how quickly I have seen change in a lot of my patients. I would say like surprisingly surprised, where I'm actually really shocked by how much nutrition impacted someone's symptoms. Someone who's had bloating for 12 years, and all of a sudden I put them on the Renew food plan, and 3 weeks later, they're like, oh my gosh, Dr. B, 70% of my symptoms resolved. No supplements, no medication, nothing, just gone. And there we're now trying to tease out, okay, what was it in that food plan? What were you eating before that didn't work? So you have to be ready to go at this for the long haul. And some people's cases take longer than others. It's not an instant gratification thing at all. So if you're expecting this like a prescription and then, I'm better the next day, that's not what it is. You have to be prepared to do some testing, because sometimes you do need to do some specialized testing for us to get to root cause. And I think ultimately you have to see the value in what you're doing and why you're doing it. Going to see multiple gastroenterologists, 3, 4, 5 different gastroenterologists, paying that copay every time and getting yet again another prescription for an antibiotic, another prescription for Nexium, a PPI, this or another test that doesn't, or another scope. I'll be honest, GIs, we scope too much. Endoscopy, what are you going to see? Like, it's just like I had a scope 2 months ago, another scope, another scope. Sometimes there's a need for it, but you have to really think, what is this scope going to show me? And how is that going to affect my patient's diarrhea? Or how is that going to affect, if I've already shown there's no cancer, what is this going to show? And I'd rather my patient invest their money in actually doing a program that involves nutrition, wellness, the right types of supplements that ultimately helps not just them, but their whole family. Because very often when you suffer from a chronic GI issue and you've been suffering for years and you're frustrated because you're not getting answers, you're not getting relief, you're seeing multiple doctors, this affects not just you as a person, but it affects everyone around you. It affects your family, your friends, your kids, your social network. So, if you're able to get relief from a program, at least try a program and see if it works, a program that's been researched, that a nerd is studying, like every night I'm going home and what can I do next for my patients with Crohn's disease? What is the latest research for my patients with ulcerative colitis or NASH? I think it's worth giving it a try than doing the same thing that hasn't worked for years. What functional medicine is not, it's not acute care. Okay, it's not acute care. When your leg is broken, one of our dietitians in the past used to say, when your leg is broken, do you want to see an emergency room orthopedic doctor or do you want turmeric? Right? When you have a fracture, that's acute. You want to go to the ER, make sure you're seen by a great ER doctor, make sure you're seen by an orthopedic surgeon who can fix this. Chronic medicine is not that. So sometimes patients will call me and be like, I'm throwing up. What are you going to do about it? And I say, well, it could be your gallbladder. It could be, you may have gastroenteritis. Heck, you could have COVID. That's not something that we deal with from a functional medicine perspective on a day-to-day. So we're kind of dealing with root cause medicine, and it's usually chronic symptoms ongoing for many, many years, and that's what we're trying to actually reverse. Okay, that's the core of it. Um, a great question is what type of progress to expect. This is an excellent question because I have noticed that the progress, like many things in medicine, depends on, of course, commitment, right? Committed to making the change, making that transformation, being consistent with it, like persevering through it. And finally, what I have seen is that the mental has a lot to do with change. You know, every win is a big win, right? Being optimistic about the possibility of healing, right? Not letting anxiety and stress pull you down. So, as a gastroenterologist, I've actually learned that it was the practice of just psychology and understanding patients and where their stress and anxiety is coming from, and the need and the importance of sometimes referring them for counseling, psychotherapy, meditation, Reiki, acupuncture to relieve stress, and actually really true counseling and discussing some deep root issues that they may be going through, and releasing those issues helps the gut heal. And until that happens, there's no amount of turmeric, omega oil, or what else do I like to use? Bovine immunoglobulins or glutamine that's going to work. Sometimes it's really deep seated between that brain gut connection where the stress is not released. And that means chronic inflammation is not released. So I hope that answers most of the questions. Someone had a question about fish oil. How much fish oil? So you want clean fish oil. So the fish oil I use, so for patients who have Crohn's disease and ulcerative colitis, I'm leaning more towards Secure, which is a powdered codfish, a very natural fish oil that's easy to absorb. But for most patients, I'm looking for a good quality omega-3 combination, DHA, so EPA, DHA combination, a good quality, good source. The studies are showing us 2.4 to 3 grams is what we need. And again, I did a video on supplements, but not all supplements are created equal. And also dosing is extremely important. So I really look at, I don't just say, just go get some fish oil and take a pill a day. I try and look at what did the study show about the benefit of fish oil to reduce inflammation, to help the gut heal, to help with brain function, to help with cardiovascular disease. And all the doses are different, right? So all the quantities are different. So depending on what I'm treating, my recommendation for the fish oil quantity in terms of grams is very different. And now I've gone through the process of measuring omega levels in every patient, and everyone is deficient. And omega 3, everyone is deficient. It's like vitamin D, everyone is deficient. But those omegas are so important to reduce inflammation in the body, for brain health, for skin health, for gut health. And so I usually, there's a brand I like, it's Ortho Omega. I usually recommend one pill with every meal, and that gives our patients around 2 to 2.4 grams. And depending on whether it's a cardiac issue, whatever, I usually up the dose. I go really high dose in our patients with fatty liver disease because I could go on forever, guys. I'm getting that cue at 7 o'clock, but I'm so passionate about functional gastroenterology, and I'm so optimistic about how much it's brought to my gastroenterology practice. It has brought back my love of medicine, which I would say about 5-7 years ago was kind of dwindling away. I feel like with this practice and with our program, I can really help patients. And it's not just a solo effort. My entire team here has helped me put this practice together, this program together. We've gone through our growing pains in terms of insurance, no insurance, how do we bill, how many visits, but bear with us. I think that fundamentally our hearts are in the right place. Our practice of functional medicine and what we are trying to deliver to our patients is in the right place. We may make mistakes as we're going along, but we're trying to learn from our mistakes and deliver an excellent signature functional gastro program that hopefully could help reverse and transform your life. So I thank you. Thank you guys for waiting for me. And asking all these great questions. I'm happy to answer as many questions. We'd love to do this again, but I wanted to introduce you guys. Welcome to the group. I think this is going to be a fantastic group. And I want you guys to remember that I learn as much from you, probably more from you guys than you guys learn from me. So any papers, any research articles, any new supplements, any products, any new information on food and nutrition, post in the group. Let's discuss it. This it is a forum. It is our playground to kind of toss ideas around, figure out what's worked for someone else. I mean, I have a huge folder called patient's preferred supplement, and every time a patient comes in and said, have you tried this supplement recently? It's Peak Bio Boom for constipation, which is great prebiotics, probiotics. I probably should invest in their company, because right now I'm prescribing it to every patient with bad constipation, because I don't want patients using prescription medication for constipation, because generally it just gets worse. But anyway, that's a whole other topic. But yeah, I could go on for like an hour, but I gotta go. I gotta go home, and the team has to get out of here. So we look forward to these Thursday lives. Our next Thursday, I'm gonna bring my superstar, Donna Lee. She just certified in IV drip therapy. So she went all the way as I was starting this program and learning so much about the benefit of IV nutrient therapy. And I said, Donna, we got to do this right. The way I'm studying with the Institute of Functional Medicine, I want you to study IV nutrition therapy. We're not creating any quick like hangover drips over here. What we're really trying to do is replete nutrition, right? Nutrients that our patients can absorb, help them when they have oxidative stress issues, help them when they're going through detox or die-off symptoms. And so Donna took the course. She certified a couple weeks ago in San Diego. She is an excellent IV drip therapist, and it's like having an expert right here. And she's learning every time and tweaking our nutrition protocols for patients. And she came in just as a physician assistant fresh out of school with me 3-4 years ago. And I'm so amazed and impressed by Donna Lee and what she's been able to achieve and how she's grown so much. So I told her we'll be doing a Q&A next Thursday, and it's going to be all those hard questions about IV nutrition therapy. What is it, friend or foe or hoax or real thing? You know, like what works? Where should you invest your money? Does it work? It'd be great to have patients talking about their experience with us in terms of IV drip therapy. But we look forward to seeing you guys next Thursday. Have a wonderful evening. Yay, Donna Lee. Have a wonderful evening, guys. Bye-bye. I talk too much.